Orders can be placed from several places in the chart, but we're going to focus on the Orders tab. Except for emergent situations, you should make sure that your patient's medication history and reconciliation are complete before you start placing orders. Also, to prevent a lot of pop-up alert boxes from displaying, ensure that the dosing weight and height have been documented. If this data has been entered, you can see the dosing weight in the banner, and both details will be available in the vital signs section of the results review. From the Orders page, we're going to use the Order Catalog. Select the Add button. There will be system-defined folders containing orders and order sets. To search for an order, type the desired order name or part of the name into the search box after selecting either Contains or Starts With filters. Contains looks at any part of the order name as defined by the letters typed in the search window. You must enter at least 3 letters to search on Contains. Starts With only looks at the beginning of the order name. For both types of searches, the results will only display up to 50 items in the window, so the search may need to be altered to find the desired order. As you type in the search screen, a My Search list of orders displays. This list can be used to select orders, but it is not a complete list. Click the binoculars to get more complete search results. In the catalog, most orders are aligned to the left margin. Indented orders represent pharmacy orders. The items with yellow square icons in front of them are order sets. To add individual orders, click on the desired order once. A window with defined sentence options may display. To save more time, you can select the order sentence closest to what is desired and modify it before signing the order. Continue to select orders until all the orders needed have been found. If the order name turns blue, you have selected the order and it is in the patient's orders for signature list. Click Done to close the search window. To complete any needed order details, click on the order and the Orders Details pane will open below. Required fields will be identified by a yellow detail field. If the required element is not entered, a blue circle with a white X will display in front of the order. Remember that some orders may need to have details entered to have complete information, even though the field is not required, such as a wound care dressing change order. Without adding information on the order, the patient care staff won't know how you want the dressing change done. Additional information can be added to most orders, even if the detail section doesn't have a specific field to be completed. You can add information on the Orders Comment tab for all orders except laboratory orders. Even though the ordering process is the same across all order types, some special considerations need to be understood for appropriate ordering regarding admit, pharmacy, lab, blood bank, and diet orders. The admit to inpatient or place in observation orders must be in place on every patient who is bedded in the hospital. This order must be signed prior to the patient's discharge. If a resident places the order, it will go to the supervising provider's inbox for co-signature. Pharmacy order considerations include non-formulary medications or patient's own meds. It may be necessary to order non-formulary medications or to use the patient's own medication supply. If the patient's own supply is to be used, complete all the order details in the same manner as a facility-supplied medication and simply click the radio button for Yes to use patient supply. If unable to locate a drug needing to be ordered after searching the catalog, it would be best to call the pharmacy to determine if the drug is non-formulary or in the catalog under an alternate name. If the pharmacy identifies the desired drug as non-formulary, order the appropriate non-formulary orderable. Complete all the order details. The orders will display on the MAR with the non-formulary and the drug name in parentheses. Another unique orderable is tapered doses. Tapered dose functionality is only enabled for certain medications. From the order catalog, select the desired medication. Any order sentence can be chosen because the taper instructions will overwrite the sentence details. On the Order Details tab, click on the Taper tool icon. If the tool is gray, tapering is not available. The Taper tool opens and contains 3 sections: Start Details, Taper Details, Planned Regimen section. In the taper detail section, define the increase or reduce for the taper. Enter the tapering rate and interval. Rate of change can be set as a defined amount or a % of previous or starting dose. Interval of change can be set to days, doses, or times. The doses must change by the same amount every interval. Final dose identifies the lowest dose and the dose limit period. Click the Calculate Steps button. After signing the order, click the plus sign in front of the order to display the details of the taper dose, including the start and stop dates. Some medications are defined by pharmacy to have a therapeutic substitution within the hospital formulary. If the medication has a defined substitution, a red diamond displays in front of the name of the order. Selecting these orders will open a window of identified available substitute orders. Select the desired option, click OK. On the order profile, drugs ordered through this process are identified with an icon in front of the line item. Other specialty ordering information related to blood bank, sliding scales, and titratable orders will be looked at in the order sets video. To order your labs appropriately, you need to understand the relationship between the priority and the frequency. Stat collection priority should only be used for one-time orders which must be collected immediately. Routine collection priority is used for one-time orders which aren't time-sensitive or urgent. Routine should also be used for any recurring frequency of greater than 24 hours. If you try to order a frequency of less than 24 hours, the lab system will cancel all but one collection. Time study collection priority is used for all labs that need a specific collection time or a recurring frequency of less than 24 hours. AM draw collection priority is used for once or recurring Q 24-hour early AM lab collections. Choosing the AM draw option automatically places the next morning's date and a system-defined morning time in the collection date field. So if the order is placed after midnight, the collection will not occur until the next morning. Frequencies cause the priority to default to routine. So if you need a time study or an AM lab, change it back from routine as appropriate. Any lab with a frequency will require a duration and duration units be entered. Choose times for the units. Choosing days or hours, etc. may result in getting more or less than intended. All time studies require entry of the initial collection date time. Never enter information into the Order Comments tab of lab orders. The automated lab system will not read or act upon the information in a timely manner. If special requirements need to be communicated regarding the lab order, place the information in a communication order. The nurse would then need to call the lab when appropriate. If tests need to be added to blood that's already collected, use the add-on lab order. You need to ensure that the appropriate specimen and adequate quantity exist in the laboratory, and indicate the date and time of the original collection of the specimen. Another special consideration are peaks and troughs for drugs like vancomycin and amikacin. You should order the peak draw instructions or trough draw instructions for the drug, and then the nurse would enter the actual lab order at the appropriate time based on your instructions. In the instances that you may find it necessary to order an uncommon or esoteric laboratory for a patient, if the desired order cannot be found, complete a laboratory downtime requisition to send to the lab. Dietary orders have several special considerations that you need to look at. If you're ordering diets that require specific instructions, like the carbohydrate counting diet, low sodium diet, kidney diet, or a combination of those types of diets, you need to make sure that you are adding all the modifiers, such as you have to tell the dietary office which level of sodium you want in your low sodium diet. Likewise for the carbohydrate count that you need. If you have a combo diet, you choose one of the specialty diets and then add the modifiers inside of the details to make up the other elements of the diet. Do not enter two different diets. If you want to change a diet order, do not modify that order. Cancel and reorder a new diet. When a patient is going to be NPO at some future time, Do not alter the start time for the NPO order. Choose the appropriate start after option, as in breakfast, lunch, or supper. This will automatically set them up to be getting the appropriate meal. That same idea is for diet orders that are going to start in the future. There's a start meal field for you to choose which meal you want to be the first meal for that patient when they start eating. If a patient is being managed by the nursing staff in their progression from the NPO status, you need to enter the nurse management of diet after NPO. Identify what the goal diet is for the patient, and then the nurse will progress them based on the hospital policy guidelines. Do not send a communication order for information for a dietitian. If you have something that doesn't have a specific field in your dietary orders and you need to have it listed, there's an order called Special Dietary Request that can be used. If you need education related to the diet for the patient, there's a Education Nutrition - Dietitian order. Use the Consult to Registered Dietitian Adult or Pediatric for consults and follow-ups. Make sure that you specify the reason for the consult. Also use it for tube feedings and TPN recommendations. If you need snacks for your patient, that's a separate order. And then you need to identify the frequency and what kind of snack. If you have a pediatric patient, please order the pediatric diet order. That's for any patient under the age of 18. There will be age-appropriate levels to choose from so that the proper type of food will be delivered to the patient. Upon signing orders, if any major drug or drug allergy contraindications are identified, the system will notify the ordering provider. If any interactions or contraindications are identified by the system, a clinical decision support window opens when signing the orders. The user can either choose to remove the order or select the override reason, then continue the ordering process. The reason can be selected at each line item or at the bottom option to apply the same reason to all items. The Continue button will not be available until a reason is selected. Once an order has been placed on the order profile, various order actions are available for working with those orders. Not all are available for all orders based on the type of order, the status, and the details of the order. To see the available order actions, right-click on the order. Unavailable options will be displayed but be dithered gray font. Modify takes an existing order and modifies it. That is not available on diets or lab orders. With meds, only use Modify for dose or frequency changes. Cancel/reorder cancels the existing order and replaces it with the exact same order, allowing the order details to be changed. Copy takes an existing order and makes a duplicate of it. It does nothing to the previous order. Renew is used on prescriptions and creates a new prescription. Cancel/discontinue cancels one-time existing orders or discontinues continuing orders. Void deletes or voids out an existing signed order. Typically, you wouldn't use this unless you knew right away that you had placed an order incorrectly and no actions have been taken on that order. On some orders, you'll see what is called reference text, which is represented by an icon in front of the order name that looks sort of like a piece of paper or a clipboard. Reference text is informational material presented to the users via OneChart. Reference text may link to documents in the Via Christi intranet containing policies, procedures, or other helpful information, or textual instructions. They can also link to external resources, such as the CDC documentation. Reference text can be attached at several points: the order set level, the order level, and the documentation level. If set at the order set level, the link will be in the order catalog in the order profile next to the plan name. Links set at the primary order level will be able to be seen and opened in the order catalog. Whenever the icon is seen, the user can hover over the icon and select the Click to See Evidence-Based Information option, which opens the reference text in a new window.